This video is for you if you have an upcoming treatment cycle and you're wanting to optimize things, or you have sadly recently had a cycle that didn't work out and you are looking to unpick it and see if you can work out what happened. Hi, it's Lucy here from Catching Rainbows Fertility and talking about the avoidable reasons why IVF fails. Now, these are a collection of points that have just emerged over the years of doing this job and realizing that much as we would love, and I would love, that we could just hand ourselves over to the fertility clinics and they would take care of everything. And I really wish that they would, but for some reason they're only covering some of the bases. There are areas they don't investigate, things that they don't look at, and if these things weren't important, then their success rates would be higher. And if these things weren't important, then I wouldn't have a catalogue of hundreds and hundreds of one-to-one clients who have come to me following a recurrent failure of IVF, and we've looked around, picked out what's going on and been able to carve their path to actually making their treatment successful. So without further ado, here over the years what I've figured out are 5 avoidable reasons for IVF to not work. Number 1, fertilisation. Now, this isn't just as straightforward as thinking about optimizing your egg and your sperm quality. This is what treatment protocol have your clinic got you on, and is it suiting your body? Now, this is something your treatment clinic won't necessarily know because it's a bit trial and error. But after you've had a cycle, they will know, how are you responding to those drugs? How are your eggs doing? How many follicles did you get, and was that a good amount for what your body is going to put the most quality into? Also, there are stimulating drugs that are basically doing the same thing, but you might respond to one much better than another. So if you've not had a great cycle and your clinic are saying just to repeat the same thing again, then maybe challenge that. Because the other thing that's a huge red flag when you're picking a clinic is if they only have set days for when they do egg collection. Because what can happen is a lady is stimulating, everything is going quite well, but because the clinic only do egg collection on certain days, she might end up having her eggs triggered slightly too early or slightly too late. So really make sure that you're picking a clinic that works across the board, that can tailor its treatment to you, that can adjust if need be, and can, just change those dates for you as and when your body needs it, to make sure that you're getting the optimum result for your body. So a good clinic will be pretty much open all hours, and they will base your treatment around your AMH levels and your FSH levels, and they will tailor that protocol to suit you. Number 2, foundations. Lay the foundations. It's all too easy for a clinic to just say, yep, go for it, just come on in, it doesn't matter what your body's doing because our drugs can just override anything that's happening with your body. Not entirely true. I think really the foundations have to be laid in order for you to get the best results. So it's like building a house, you want to put the foundations in, and you don't want to be slovenly, you don't want to paint over wallpaper, you want to strip everything down, make sure everything is working to the best possible quality that it can be. So when I say lay the foundations, it's about getting you as well as you can be, and don't mistake that for meaning you have to be perfect. Like, you don't have to be zen and amazingly positive and everything perfect, but it is really good if you can be the best that you can be, and that doesn't mean that you can't be feeling worries and doubts and all the rest of it. But it does mean it's worth looking at your physical self, your cycle, how's that behaving, what's your bleed like, are you getting lots of old brown blood, are you getting clots, are you getting pain? All these things are just signs that your uterus could do with a bit of nurture, a bit of nourishment in the right direction, just to be her very best self, so she is as receptive and ready as possible, and that your body is feeling strong and well and able to cope with actually physically processing the drugs that you're going to be taking. So it's absolutely worth just taking a few weeks sometimes just to put those steps in place, even though sometimes we've got that pressure of time and age is against us. Sometimes it will really set you back to just go ahead with a treatment cycle when your body is not ready, it's not happy, it's not okay. Invest a little bit of time, whatever you can feel comfortable in, and just get the right advice to get your cycle the best that it can be. So that brings me into point number 3, which is an issue with your lining, an issue with implantation, something going on with that luteal phase, you know, that second half of your cycle between ovulation and period. So the clinics won't look at that. They won't look at what your cycle does, how it behaves. But if that period in your cycle is too short, or it's too unsteady, it's not stable, then it's not going to be corrected by just taking the synthetic progesterone. You want to get those foundations built. You want to correct that progesterone and get your body the best that it can be. So I can give you an example. I had a lady who had had 5 failed IVF cycles, and she had 1 frozen embryo left, and she found me and said, I'm just trying to throw everything that I can to try to give this frozen cycle a chance, because after that we've run out of money, I've run out of anything that I have in me that would allow me to go through this again. And so we looked at her cycle, and straight away I could see she's ovulating, and 7 days later she's coming on her period every single month. 7 days is not enough. It's not long enough. There's no way that the progesterone on its own will lengthen that cycle behaviour enough to give that embryo a chance to implant. Now, it doesn't always look as obvious as that, but with a few simple tweaks, her cycle was sorted within a couple of months. She went and had the frozen cycle, and it worked beautifully. And I can tell you loads of stories like that, but the point is, for you, it's working out what is your cycle doing. When are you ovulating? For sure, when are you ovulating? Not when you think you're ovulating or when your app has told you you've ovulated. When are you ovulating? And you can tell that best by doing a temperature chart. You can use those monitors, but again, they're a little bit hit and miss. But it really is about making sure that you've got 10 steady high temperatures between when you ovulate and when you start bleeding. And ideally you want, 12 days to 14 days before you actually bleed, but 10 is doable. So the other aspect of implantation and lining is just making sure that it's thick enough, that it's warm enough, that it's nourished enough. Have you got enough blood flow there? Is your body distracted by putting blood flow into other areas of your body that are struggling? People who have digestive disorders often have this issue where the body is so busy trying to sort out that one ailment that the uterus kind of gets put on the back burner. So sometimes to look outside of that box, to look after other aspects of your body, and to make sure that your bleeding is behaving as it should be. So rule of thumb, you should get a good couple of days of a decent flow, and that's red blood. Doesn't have to be super heavy, but you need to have some fresh blood there, and you don't really want to be days and days and days of just brown old blood or very heavy, very clotty. And it's going to be impossible for me to address every potential issue that you could have with your period in this video, but of course feel free to get in touch. We can help wherever we can. We do one-to-ones, and we do have some resources on the website to help you unpick your cycle, but we've also got tons of blogs and videos for you to watch and read as well that could give you some pointers as to what kind of things you might identify with your own period and what steps you can take to make that better. So that is number 3. Number 4 is a bad transfer. So embryo transfer is a really important time, and what happens is they will pass a very small thin tube, a catheter, up through your cervix, and then the embryo will be deposited into your womb. And as that catheter is passed, your cervix will take note of this, and your uterus will go, what the hell is that? And it will just start spasming and twitching. Now, that spasming and twitching can be worse in some women than others, and it can go on for a day, 2 days, or even just hours, enough to expel the embryo that's been safely put back and to make it really difficult for that embryo to settle. Now, we do overcome this by advising women to do the bladder technique and the embryo transfer technique. The bladder technique is essentially just rehearse, work out how full does your bladder need to be comfortable, because they will often ask you to attend with a full bladder so that they can scan you whilst they're doing the embryo transfer. You don't need to be crazy bursting, gonna wee myself full. You just need to be comfortably full. But how much water do you need to drink? Only you can know that if you experiment beforehand. So it's just worth emptying your bladder, take a look at the time and just, you know, drink a glass of water like this, and then just see how long it takes for your bladder to become comfortably full and adjust it accordingly, and just know what your little brackets are for that. The embryo transfer technique is a relaxation tool that you can listen to and learn how to work those muscles and calm everything down around the uterus, the pelvis, the pelvic floor. It's a really simple exercise, and it will make your transfer far, far smoother and give your embryo a greater chance to settle in and implant. Now, we have that for you free on our website to download. You're very welcome to have it. There is an IVF little cheat sheet, and there is the audio for the embryo transfer technique, and that's on catchingrainbowsfertility.co.uk, which I will link in the description box below, so you can just buzz over and grab that if you want to. In terms of transfers, if you think actually everything else is in place and none of these other things have been an issue for me, every so often there is a woman that comes up and we just think there's nothing else going on here other than you've had really tricky transfers. And I once had a lady who had been having problems with her transfers. They were always quite painful. She always found them really difficult, and I just suggested that maybe she could try getting a mock cycle done where they would try to do a transfer without actually doing a transfer. And they found actually her cervix was really, really tightly clamped shut. It was very difficult to pass the catheter through, and she said it looked very likely that her embryos had not been put in the right place before, and that actually they'd never been able to visualise them on the screen before. They'd never seen the catheter come through to the uterus, and so they were just hoping for the best and assuming that it was poor visualisation. And it turned out her healthy, lovely embryos had not been going anywhere where they were supposed to be. That's rare, but it's worth mentioning. You know, if transfer is something that you need to work on, then use a transfer technique, go and have a mock cycle done, and hopefully that will make all the difference. So last but not least, number 5 would be there's something else going on emotionally, spiritually. You're not okay in some sense. Sometimes I just think women have been too traumatized, too broken, and it's not okay for them to go back into that cycle, and they just weren't able to be receptive. The energy wasn't there, or maybe there's some other wound still to be healed, something that there's still some work to do. I could give you another example, which would be I had a lady who had 7 years worth of unexplained infertility, multiple rounds of IVF, nothing had worked, and she came to see me and was hoping that she could get her next round of IVF to work. And I straight away saw this very lovely, kind, nurturing, beautiful woman who was very in love with her husband, but seemed to be somehow disconnected on an energy level from her uterus. It was like sex and this area of my body, I kind of have to dissociate from that. And I just felt like the two weren't connecting, and that maybe that's why her body wasn't receptive to pregnancy, because it was just shut off from that area. And when I talked to her a little bit about this, it turned out that she had sadly been abused as a child, and the way that she had learned to cope with that was just to shut down and shut off and just put that over there. Now, I just felt like if we could restore that relationship a little bit without forcing her to go through really traumatic bringing up of old stuff and months of therapy, I just thought this doesn't have to be really, really full on. It could be gentle, it could be simple, it could be loving. And so we just went with instinct, had a relaxation and did some hypnosis with her, where basically it was as though her adult self was with her child self, and she was saying, you did really well to cope with this, and the child wanted to give her the energy of her uterus to look after, to keep it safe. And she visualised this as like a ball of light, and this was all coming from her, and she gave it to her adult self to keep safe. And then we had a conversation about whether she was ready to put that back in place and let it kind of fill up with light again. And she didn't feel able to do that. So we decided instead, is there someone that you trust that you could give it to? And so she, in this relaxation, she gave it to her husband. Her husband put that light back inside her. And it was like this transformation. It was really, really beautiful. It was really moving, and it was just part of her story. And her IVF didn't work, but she got pregnant naturally the cycle after, and it was really weird. It was like, this was for her body needed to do it on its own. Her body, not that, you know, natural pregnancy is the gold standard of pregnancy, but for her it was quite symbolic that her body wanted to feel that empowerment back, and it just almost sidelined the IVF and went ahead and managed something naturally that it hadn't done before, and they then went on to have another baby after that. So it's not always straightforward. Everyone is complex. We've all got our own paths, and it can be something emotional, it can be something physical, something practical, or it can be a mixture of the two. So my job and Cath's job is to help unpick that and help work out your story. So if we can help you in any way, please do get in touch. And I hope this video has been helpful. If you have liked it, please like the video and subscribe to our channel to get more of the same, and I'll see you in the next video.